Now, Sangeeta Reddy, obviously, everyone's expecting that health will be a big focus of the budget. Many people have spoken about how India only spends between 1 to 2% of its GDP on health. Realistically, Sangeeta Reddy, given the fact that the government seems somewhat constrained financially, do you really think that that is going to go up to that kind of figure, 3–4% that people have been talking about?
So I think the 3% is an aspirational target over the next 2 to 3 years. But this year, we're definitely expecting in this dream, once in 100 years budget, we're definitely expecting a considerable increase in the outlay for healthcare. And I'm pretty sure that considering the fact that everyone realizes the speed of the vaccine rollout is directly proportionate to the speed of the economic recovery. And additionally, everyone also realized during this time period the need for enhancing healthcare and the fact that India can do so much globally in healthcare. Considering all these factors, we're definitely expecting a good budget outlay for healthcare.
Now, Sangeeta Reddy, let me ask you though in specific terms that if the government is going to spend more, where would you like that money to be specifically directed?
So clearly there's an initial amount of about 25,000 crores that needs to go into administration of the vaccine, the purchase and the administration. And while this cost could be shared with citizens as well as corporates, there is also money to be spent in terms of enhanced rural outlay for primary healthcare centers, which is already part of the plan. There is also a significant need to capitalize and to roll out the National Digital Health Plan, because that is a very powerful foundation for the future of healthcare. It's been well conceived, well designed. It now needs the budget outlay and the collective intent of the whole nation to really roll this out.
Okay.
So,
okay, that's one. As far as the private sector though is concerned, Sangeeta Reddy, what would you see that role coming from private hospitals like yourselves and others in also kind of leaning in at this time?
So undoubtedly, Srinivasan, that we cannot achieve what we're trying to without the public and private working together. And I think the way we did testing or the treatment of COVID patients is a good example of how we can achieve so much when we work together. Keeping this factor in mind, I think that more enhanced and increased frameworks for public-private participation, an ability to encourage people to get into the provisioning of healthcare directly, because hospitals are actually the toughest thing to run, the lowest margin, yet a critical part of the overall infrastructure. So whether it is in enhanced depreciation or methodologies to do appropriate reimbursement, continuing to fund Ayushman Bharat is a very important plan or a step towards universal health coverage, but also enhancing the income tax write-off towards health insurance premiums and towards health checks. Because we need to look at both, not just the treatment, but how do we keep the population healthy? So all these combined is what the private sector is really looking for in this budget, which is not really a direct infusion of capital, but a support so that we can continue our thrust towards saving the nation.
Okay. When you spoke of Ayushman Bharat though, which is the government's sort of healthcare insurance scheme, you're saying that should be continued, it should be enhanced, and I believe there is some talk that the government might do that. But there was also concern, Sangeeta Reddy, that private healthcare providers, insurance companies were resorting to overpricing and so on and so forth. How legitimate are those concerns, and if they are, then how would they get addressed?
So I think all these are steps towards the progress, it's steps towards evolution. And that's why I spoke about the National Digital Health Mission. Because using IT, you can control, you can look at appropriate levels of care. We need to combine health economics to really study the cost of serving and ensure that there's a reimbursement to hospitals which covers the cost and ensures that there's a little bit of surplus so that they can reinvest towards development, to cover depreciation, to reinvest in technology, because the health sector is evolving very, very fast. And India has the potential to become a major hub for medical travel from across the world. We also have the potential using remote healthcare to not only serve our villages, serve the underserved in the urban poor, but also serve the global population. So focusing on healthcare, investing in social sector is a very important thrust for this budget, in my opinion.